Hi, my name is Sarah Ford. I am working on my Pathophysiology Final presentation for University of New England Online. I will be doing my presentation on polycystic ovarian syndrome, which the National Center for Biotechnology Information states that PCOS is considered one of the most common endocrinopathies of women of reproductive age. Up to 10% of women of reproductive age have PCOS. This syndrome manifests in myriad ways. The signs and symptoms are evident in hirsutism or excess hair growth on the body and the face, and even biochemically as elevated androgen levels. And we'll get more into that as we go forward. The etiology of PCOS is not certain. Scientific and medical communities alike are not sure, but there are known correlations between insulin resistance and inflammation being linked to that trademark increase in androgen that we see biochemically. The clinical manifestations of PCOS are varied, but generally we'll see a woman complaining of obesity, anxiety, depression even. This person probably has some appearance of acne, hirsutism, or that hair growth on their face or their body. They'll also maybe complain of oligomenorrhea, which is less than 9 periods in a year, so fewer periods than what we'd anticipate in an otherwise healthy individual. These periods can be very, very heavy. That it seems to be the trademark in what I've read the most, but some women complain of very, very light periods, but more often just less periods than we should be having. Also, if applicable, repeated miscarriages or subfertility, difficulty getting pregnant if the woman is trying to get pregnant. Infertility is defined as trying to get pregnant for over a year and being unsuccessful. But recurrent loss of pregnancy is a sign of that as well, PCOS. When we're looking to diagnose PCOS in a woman, per Radiopaedia, which is a resource for radiologists, internal medicine physicians as well, there seem to be a triad, and of this triad, 2 of the 3 criterion must be met for that diagnosis. And that triad would be a physical exam, which can include ultrasound, symptoms, signs and symptoms that we've just discussed, and blood tests. On the physical exam, we will see that, again, excess body hair, obesity, the BMI scale for that patient, although the BMI is not being used as much to assess a patient, it's still applicable here that they will be considered obese in that scale. Acne and that less period than normal. Also, subfertility or infertility. On blood test, there are plenty of signs that we can look for in that patient. Again, excess androgen and testosterone, both of those will be elevated in the patient consistently. Estrogen can be high or within normal limits. The sex hormone binding globulin, or SBGH, is low generally. Follicle stimulating hormone will be low, and luteinizing hormone, or LH, will be elevated. The levels of glucose and triglyceride in your CBC and differential will both be elevated, which is a trade marker of complications in PCO, which we'll get to in just a couple of minutes. On the ultrasound, which is part of that physical exam, findings on ultrasound will show an increased number of follicles, given that name polycystic, many cysts on the ovaries. The threshold for diagnosis used to be 12 follicles on each ovary. Now it's more generous. It's 20 or more follicles for each ovary. Something I read interestingly on Radiopaedia was the overdiagnosis of PCOS done in women that were less than 8 years past their point of menarche, so their first menstrual period. That is a common pitfall. Generally, we'll have a lot of follicles in that time where we've just started our periods, up to 8 years after that time. So after 8 years, after starting your period, or within your 20s, you should have less than 20 follicles on each ovary. But more than 20 indicate that you may have PCOS sonographically. Differential diagnoses. One syndrome, Cushing syndrome, shows a lot of the same types of symptoms and signs in the patient with PCOS. That includes the high androgen, but that's usually due to overactivity of the adrenal glands. Symptoms can follow a similar pattern in that patient as well, with anxiety, obesity, and depression too. Complications, again going back to that high triglyceride level, and hypertension, high cholesterol on that CBC, is NASH, or non-alcoholic fatty liver. Basically, the liver accumulates too much of the fat, either dietary or the body just kind of holds on to fat more than it should in that patient. So this was my summary overall on PCOS, or polycystic ovarian syndrome. It's a very interesting syndrome that I'm hearing more and more about the older I get and the more I'm in the hospital. I hope this was helpful to everyone listening, and I hope you all have a good day. Thank you.